Well, as we know, in just about every jurisdiction in this country, rapid antigen test kits are in, well, high demand, which is an understatement. With changes to testing requirements, they're more important than ever. Industries which need them the most to get their staff back to work are struggling to get access to them. Food distributors who service hospitals, nursing homes, schools and childcare centres are working overtime to provide supplies for the most vulnerable. That chain is on the brink of breaking. The Prime Minister today said he's committed to getting people back to work safely.
With so many cases appearing every day, and that expected to continue until its peak, this will have an obvious impact right across our supply chains. Now, that's to be expected with a serious escalation in the cases that we've seen. And that will, of course, have impacts, and it's important that we continue to problem solve right across all of these areas, be it in transport, healthcare, aged care, as we've already been doing. But, of course, we require a fair bit of patience through all this process as well. So the goal is to get as many people as safely at work in these critical sectors that keep Australia moving as possible.
It is hard to imagine how the government will be able to find an instant solution to this crisis unless we start receiving millions of those rapid antigen test kits ASAP. And, of course, then prioritise the right places to put them and give them in. Now, the shortages will have major knock-on effects for people in need of critical supplies. Joining me to discuss this is CEO of Independent Food Distributors Australia, Richard Forbes. Richard, thanks for joining us. Your members are finding it extremely difficult to get their hands on rapid antigen tests at the moment, aren't they?
They absolutely are, Chris. And, we service around 1,500 hospitals and aged cares. So we need those rat tests as soon as possible. And in order to do that, we need help from the federal government. We need help from state governments and territories as well. We've got situations at the moment. I know of one member that services 50 hospitals and aged care centres. He has 175 of his staff out of 350 in isolation at the moment. Oh. So we need all the states and territories to agree with the PM tomorrow at National Cabinet, and that is to change the rules. Those having close contact isolation from 7 days down to 1, that will get workers back in the warehouses and along the food supply chain.
See, the problem with that, there's a risk, there's an inherent risk. However, so many people are vaccinated. This is a mild strain, and we've got to balance that with the prospect of not even being able to feed people in aged care and in hospitals. We cannot allow that to happen, can we?
We absolutely can't. And, this is where I think we need to come up with a criteria surrounding critical industries. I would have thought food in the health sector for the most frail in aged care and the sick in hospitals is pretty high up there, Chris.
Now, you were part of these discussions last night. I noticed that the acting Small Business Minister, Anne Ruston, was guiding a group of people, a group of industry representatives through these talks. Were they constructive? Were the right people there? And do you think they've got the message?
Yeah, look, it was a really, really important forum last night, and the right people were in the room. There were about 20 peak bodies. They ranged from the National Farmers Federation right through the supply chain to restaurant and catering. So we had not only farmers, but we had suppliers, manufacturers, distributors, and then right through to hospitality. What came out of that meeting, and I think for Anne Ruston it was a listening exercise largely, was that right along Australia's food supply chain, we have staff shortages of between 25% to 40%, and it's around 50% in hospitality because of rising COVID cases and then all of those close contacts having to isolate.
So you've got to work with both the states and territories on this, because not only do you need National Cabinet to approve changes to isolation rules tomorrow, they're meeting at midday, you've got to also be first in line with your hand up to receive some of the first batches of these rapid antigen tests. Do they recognise that?
Well, I hope they do, but at the moment we're not seeing any action in terms of getting lists of suppliers to help us. So, I'm not sure. This is a two-edged sword, Chris. It's okay if the states and territories come on board, and we'd welcome that. We need a national agreement. We have 2,000 trucks on the road delivering food. You can't have a truck driver going from one state to another with different close contact isolation rules.
No.
But if the rules do change, that's great. But the rules will stipulate that you must have no symptoms and that you must test on day one, and that test must be negative. You can only do that if you've got rat tests available.
Yeah.
So, we are sourcing long and hard right across Australia to try and find companies that have supplies that are importing rat tests in bulk. We need them, and we need them desperately. The individual I talked about in Queensland servicing 50 hospitals and aged care centres, that's 2 or 3 times a week. That's 20 tonnes of food. So if he has half his staff in isolation and they can't test themselves because we can't get the rapid antigen tests, then how can we deliver that food?
Let's keep in touch. It's very important that you're near the front of the line. All your members are. Richard Forbes, thank you for that.
Pleasure, Chris.